drawing focus on mental health issues, particularly in the backdrop of the COVID-19 pandemic, which has impacted every aspect of life globally. A webinar on World Mental Health Day was on Friday organized by the Meghalaya State Legal Services Authority in its video conferencing room at Shillong. Member Secretary, Meghalaya State Legal Services Authority, N.A. Khan, delivering the keynote address, drew focus on Mental Health Care Act 2017. Highlighting the provisions of the Act, Khan informed that the Act aims at decriminalizing the attempt to commit suicide by seeking to ensure that the individuals who have attempted suicide are given the opportunity for rehabilitation from the government. The Act also aims to empower persons suffering from mental illness and also safeguards their rights along with the access to health care and treatment as any other patient without discrimination. The resource persons were Dr. Arvind Nangpur, Assistant Professor and HOD in charge NAGRIMS, who spoke on psychological impact of COVID-19 on mental health, and Dr. Atul Ambekar, Professor, National Drug Dependence Treatment Center, NDDTC, AIMS New Delhi, who spoke on public mental health issues related to alcohol and drug use, legal and policy perspective. The webinar saw the participation of representatives from Meghalaya Police, Social Welfare Departments, Legal Care and Support Centers, paralegal volunteers, panel lawyers, MIMHANS and District Legal Services Authorities.
Webinar, I just feel that it is necessary for us to look this problem of mental illness from all aspects. I'd just like to look at this mental illness because under the new act, that is Mental Health Care Act 2017. Now this is a new act. All of us maybe who are working in this field, they might be aware of this new act. And why did we have this new act and the old act of Mental Act 1967 was repealed. Now this act was repealed because there was a need felt to understand this problem of mental illness and our approach towards people who are mentally ill. And our country being part of the signatory of the UN Convention for the Disabilities, which sets the platform and at the highest level to understand this problem of mental illness. Now this Mental Health Care Act 2017, there's a drastic change in the way we look at the mental illness. The most important and the salient feature of this act is that it recognizes that the person with mental illness constitutes a vulnerable section of society and are subject to discrimination in society. This act recognizes that. Then again, the families of those people, they have to bear financial hardship, emotional and social burdens of providing treatment and care of their relatives with mental illness. And person with mental illness should be treated like any other person with health problem, and we also have to ensure that they live in an environment which is conducive for their recovery, rehabilitation and full participation in society. These things were not there. This is the first time under the Act 2017. The Act basically recognizes these things, and then it has got certain provisions which takes care of which it intends to achieve. Now the most important thing here is this, is that the Act provides for the treatment, care, rehabilitation to improve the capacity of a person to develop his or her full potential and to facilitate his or her integration into community life. Fulfill the obligation under the Constitution and the obligation under various international conventions ratified by India.